Hey everyone, it's Sejal, your friendly neighborhood pharmacist and founder of Pharmpsychology. You know me, I'm all about empowering women to make the best choices for their health. And when it comes to our bodies, knowledge is power. So today, we're diving deep into the world of birth control. We're gonna break down all the options out there, from pills to patches, IUDs to implants, and everything in between. Think of me as your guide through this sometimes confusing world of contraception. We'll explore how each method works, its pros and cons, and what to consider when choosing the right one for you. Whether you're just starting to think about birth control or you're curious about different options, this video's for you. So grab your notepad, get comfy, and let's get informed.
All right, let's start with the heavy hitters, hormonal birth control methods. These little guys work by telling your ovaries to take a chill pill. Literally, they use hormones to prevent ovulation, which means no egg, no pregnancy. First up, we've got the OG of birth control, the pill. You pop one every day and boom, you're protected. Then there's the patch, a discreet little sticker you wear on your skin and change weekly. And for those who want a set it and forget it option, there's the vaginal ring, a flexible ring you insert for 3 weeks at a time. And for the ultimate long-haul solution, we have the implant, a tiny rod inserted under your skin that can last for up to 3 years. The great thing about hormonal methods, they're super effective. We're talking like 91 to 99% effective when used correctly. But like with anything that messes with your hormones, there can be side effects.
Next up, let's talk about a method that's near and dear to my heart because it's small but mighty. I'm talking about IUDs, or intrauterine devices. These little T-shaped devices are inserted into your uterus, and they provide long-lasting protection against pregnancy. Hormonal IUDs, like Mirena and Kylena, release progestin and can last for 3 to 8 years. Then there's the copper IUD, Paragard, which has no hormones and can last for a whopping 10 years. While insertion can be a little crampy, it's a quick procedure, and many women find that the long-term benefits outweigh the initial discomfort. IUDs are incredibly effective, but they're not for everyone. Some women experience irregular bleeding, especially in the first few months, and some may have heavier periods.
Now let's move on to barrier methods, which are exactly what they sound like. They create a barrier between your egg and those little swimmers trying to reach it. The MVP of this category is, of course, the condom. It's the only method that protects against both pregnancy and sexually transmitted infections. So, always wrap it up, folks. Then we have the diaphragm and cervical cap, little dome-shaped devices you insert into your vagina before sex to cover your cervix. And let's not forget Spermicide, a gel or foam that comes with applicators for easy insertion. The great thing about barrier methods is that they don't involve hormones, so you don't have to worry about those pesky side effects. Plus, they're readily available over the counter. However, they're not as effective as hormonal methods, especially if they're not used correctly every single time.
Chapter 4. Tying the Knot Permanent Birth Control Options. For those of you who are absolutely positively sure you don't want kids, or you're done having them, there's always the option of permanent birth control, also known as sterilization. For women, the most common procedure is tubal ligation, or getting your tubes tied. It's a surgical procedure that blocks your fallopian tubes, preventing eggs from reaching your uterus. The advantage? It's highly effective, like 99% effective, and it's permanent, so you never have to think about birth control again. However, it is a surgical procedure, so there are risks and recovery time involved. Chapter 5. Au Naturel, Fertility Awareness and the Pull-Out Method. For those who prefer a more natural approach, there are methods like fertility awareness and withdrawal. Fertility awareness, or FAM, involves tracking your ovulation cycle by monitoring your basal body temperature, cervical mucus, and other signs. Then there's the withdrawal method, also known as the pull-out method, which involves the male partner withdrawing before ejaculation. The good news is that these methods are hormone-free and don't require any medical procedures. The not-so-good news is that they have a much higher failure rate compared to other methods, especially if they're not used perfectly every time.
Chapter 6. Oops, I did it again. Emergency contraception to the rescue. Okay, let's talk about those oh crap moments. You know, the ones where the condom breaks. or you forget to take your pill, or things just get a little too spontaneous, that's where emergency contraception comes in. We've got a few options here. First up is the morning after pill, also known as Plan B. It's most effective if taken within 72 hours of unprotected sex, but it can be effective for up to 5 days. Then there's Ella, another type of emergency contraceptive pill that's effective for up to 5 days after unprotected sex. And for the most effective emergency contraception, we have the copper IUD, which can be inserted up to 5 days after unprotected sex to prevent pregnancy. Emergency contraception is a lifesaver, but it's important to remember that it's not as reliable as using regular birth control.
The choice is yours. So there you have it, a crash course in all things birth control. We've covered everything from hormonal methods to barrier methods, IUDs to implants, and even emergency contraception. But at the end of the day, choosing the right birth control method is a personal decision. It's like choosing the right skincare routine. It depends on your individual needs and preferences. What works for your best friend might not work for you, and that's totally okay. The most important thing is to be informed, talk to your doctor or healthcare provider, and choose a method that you feel comfortable and confident with.